Dale Carnegie said in his book, How to Win Friends and Influence People, that it's not what you say, but how you say it. But when it comes to how you and your staff communicates with patients, it is what you say and also how you say it. I filmed a Dentistry Uncensored video with Amy, one of our team members at Today's Dental, sharing tips on treatment plan presentation. It's something you should really listen to. She's very sharp. In the video, Amy shares some great advice to help treatment coordinators make sure they're guiding patients straight into scheduling their next appointment. A few examples. Leading the way towards a successful conversation. If a patient calls to cancel an appointment, Amy says the response should be something like, okay, I'll cancel this appointment and let's get you rescheduled. How about Monday at 2 or Wednesday at 3? Suggest an exact time while the patient is still on the phone so the conversation is not, would you like to reschedule? But for your next appointment, would this window work for you? At the end of the patient appointment, the treatment coordinator should say, let's get you checked out. I'm going to look up your insurance right now, and once I find out your coverage, I'll schedule you for our next opening. Don't ask if the patient wants to schedule. Start the scheduling process for them. Steer your conversations toward the goal of acceptance. Flexibility isn't really feasible in the dental practice schedule. The same principle applies when you need to have uncomfortable conversations too. For instance, I've noticed that patients seem to consider it less important to be on time for their appointments recently. I suspect this stems from how, before the coronavirus pandemic, patients often were coming to their appointments from an office environment, which is more regimented and fussier about schedules and on-the-clock time. Now many people have shifted to a work-from-home environment, which often treats time as a more flexible, malleable concept. As many companies have discovered, you don't always need employees' butts parked in their chairs during a specific time frame for them to get things done. Maybe they take a long afternoon break to pick up their kids from school, but catch up after dinner, for example. But some patients seem to consider their dental appointments as having similar elasticity. They're more likely to drift in 15 minutes late nowadays. Being thoughtful, kind, and firm. At Today's Dental, we always explain to patients that if they're more than 15 minutes late, they'll automatically be rescheduled. We position this in the context of fairness. If we were to try to squeeze in all the work in such a compressed time frame, it's not fair to the patient. If the hygienist has to rush through treatment, for example, the patient will miss out on a truly thorough cleaning. If they arrive late and expect the full treatment time, it's not fair to the next patient, whose window will then be pushed later or compressed. Even in right-to-work states, firing an employee can be problematic from a legal standpoint. To protect your business, you need to demonstrate that you've given an employee multiple opportunities to correct the issue at hand, and you can't do that unless you discuss it with them. Every person who works in a dental practice has the opportunity to practice and employ the principles of thoughtful communication, which will lead to higher patient acceptance of treatments, of patient payment plans, and of appointments. It's up to you and your team to master these techniques to ensure that your practice is as productive as it can be. Build trust and rapport. Be personable and empathetic. Patients are more likely to trust you if they feel understood and valued. Listen to their concerns without interrupting. Use positive language. Instead of, we can try to help, say, we are confident this treatment will improve your oral health. Clearly explain treatment plans. Simplify the language. Avoid dental jargon. Explain treatments in a way patients can easily understand. Instead of, you need an endodontic procedure, say, we'll perform a root canal to save your tooth. Highlight the benefits. Focus on how the treatment will improve their health, comfort, or appearance. This crown will help prevent pain and allow you to eat comfortably again. Address financial concerns proactively. Offer financial options. Break down costs and provide payment plans or third-party finance options. We can spread out your payments to make this manageable. Discuss insurance up front. Help patients understand their coverage and out-of-pocket costs. Create urgency without pressure. Explain consequences of delaying treatment. Patients often respond better when they understand the risk of waiting. If we don't treat this cavity soon, it may lead to a more extensive and costly root canal. Be a scheduling expert. Simplify the process. Make it easy for them to schedule by offering multiple options for dates and times. Would you prefer a morning or an afternoon appointment next week? Avoid open-ended questions. Instead of when would you like to come in, say, I have Tuesday at 10 or Thursday at 2. Which one works best for you? Leverage technology. Send reminders. Use automated text or email reminders to confirm appointments. Pre-schedule the next visit before they leave. Schedule their next hygiene appointment and confirm it via email or text. Overcome objections. Gracefully listen carefully. Understand their hesitation and whether it's time, cost, or fear. I hear you're worried about the cost. Let's go over payment options that might help. Empathize and educate. Reassure them about safety, comfort, and necessity. Follow up. Stay in touch. For unscheduled treatment, follow up with a friendly call or email a week later saying, we wanted to check if you had any further questions about your treatment plan. Personalize their reminders. Mention specific benefits of the treatment or address their previous concerns. Celebrate successes. Acknowledge progress. After treatment, celebrate the patient's decision and emphasize the positive outcome. You made a great decision. This crown looks fantastic and it's protecting your tooth perfectly. Look how much healthier your gums look now that you've removed all your wisdom teeth. Train continuously. Take online courses on dentaltown.com for treatment plan presentations. Practice role-playing. Regularly rehearse conversations. Learn from objections. Analyze past interactions to improve future communication. Always leave the patient with a smile and genuine assurance that they are making the best choice for their oral health and well-being. This instills confidence and trust, leading to better scheduling outcomes. If you enjoyed this episode of Howard Speaks, please like, subscribe, share, and comment below. I do read all of your comments. I appreciate you, your thoughts, and support. So be good and have a rocking great day.